Welcome back to the Injury Podcast. When we think of injuries, many times we think of broken bones, we think of surgeries, rehab, but we don't often talk about the invisible injuries. Not enough has been discussed, shed light on, but the psychological effects of an accident are the things we can't see, but they affect our mood, relationship, sleep, and emotional well-being. Today, we're going to dive in and we're going to shed light on this topic that's often neglected, the psychological effects of an injury, because healing is just not about the body, but it's about the mind and the spirit. And we're fortunate today we have an awesome panel here. We have a great special guest. We have Dr. Dario Wells. She is a licensed psychologist who's been practicing for over 3 decades in Boca Raton. She works primarily with adults, couples, and families, and her approach is highly interactive and tailored to each individual. Dr. Wells is trained in multiple modalities, including cognitive behavioral therapy, family systems, psychoanalytics, behavioral therapy, Rogerian therapy. She's also certified in EMD practitioner, and she has specialized approaches that can help patients overcome trauma. Dr. Wells holds a doctorate from Illinois School of Professional Psychology in Chicago and is licensed in Florida. And as well, she's authorized under PsychPAC, which is a commission that provides telepsychology services across state lines. On a personal note, she's fluent in Italian. Buonasera. I think that's good afternoon, right? And I know from our conversation, she brings both the clinical experience and a very human, compassionate perspective to her work. We're honored to have her here to shed some light on this often overlooked psychological effects of injury, PTSD, and trauma recovery. And to my left, we have our own Diana Diaz. She is the office manager of Lake Worth Injury and Wellness. She sees firsthand what patients go through in the office, and she gets a different perspective because she's there helping treat the patients. She's there helping them with also administrative tasks. So she sees patients under different circumstances. Okay, so welcome everybody today. So let's get started with, let's pretend somebody doesn't know what PTSD is, post-traumatic stress disorder. I know that at least. But let's say somebody doesn't really know what that is. How would you describe that, Dr. Wells?
I would describe it as an effect that you have after a traumatic event. So we have 2 kinds of traumatic events. We call them big T and little t. All right, so a big traumatic event is something that would be traumatic to almost anyone. Plane crash, combat, horrible car accident with multiple injuries and maybe deaths. That would be traumatic to anyone. That's considered a big T. And then we have little t's, and those are things that might be personal to someone. They had something humiliating happen in their life that is blocking them from, going forward with their emotional well-being, and it affects their life in one way or another, and they may not be aware of how it affects them.
Okay. So with that, what if somebody was in a car accident? What would be some normal things they might feel after? And then what would be some red flags or things that would not be normal or okay, or something that they should seek further help about?
Okay, so psychologists, I learned in school, see people as either neurotic, psychotic, or dead. So there is no such thing as normal. Okay.
All right.
So a normal reaction, it depends on the person. You might have a person that's very calm, cool, and collected, and what they're doing is they're just delaying their response to when they they're not dealing with an emergency situation and they can let it all out. Somebody else might be hysterically crying. Now, that doesn't mean that one person is better adjusted than the other. They just react differently. Both of them may not show effects for a few weeks or a few months. It all depends on children. Sometimes the effect won't show until the child is able to cognitively understand what happened. Okay, so when they understand cognitively what had happened, they may be traumatized, realizing, oh my gosh, their parent could have died, and how horrible that is. They knew someone else whose parents did die, because they don't understand those things, but they remember them, and then when they get to that age, they make up stories
Right,
about it.
and it kind of comes back and so forth. So, what would be some abnormal effects of that of somebody in an accident,
Okay.
where maybe there's a lot of chiropractors that watch this, or there's other people that might know somebody that was in an accident. What are some things that if occur after the accident would be red flags, meaning that somebody should see someone?
Um, all right, they probably don't want to drive. They're going to ask for rides. They're not going to want to go out. Their moods may change. They either may become very talkative, or if they were very talkative before, become very quiet. You may sleep disturbances, nightmares, getting very jumpy, having a startle effect. And you see that in animals as well.
So somebody also, their partner, their spouse, or child or brother, sibling, somebody that's exhibiting after the accident a different in personality or mood changes that are just not for a day or two, but are lasting longer. Would that be something that if
Yeah.
somebody notes,
Yeah,
they should?
if it lasts for a few days, a few weeks, okay. But if it really continues, that's probably something they should seek some professional help.
Right. Okay. All right. So getting into that now, seeking professional help from a therapist. Now, there are a lot of different therapists out there that help all kinds of different people with different types of concerns that they might have. What should someone that is a therapist treating someone that has, let's say, was in a car accident, they keep, they have a change, a shift in their mood. They're having a shift in their sleeping. They're having a shift in maybe at work, they're not able to collaborate with others. They're or they're at work, they're all of a sudden getting into fights and arguments, or totally withdrawn. What would be some things that a therapist that somebody should look for with a therapist? I know it's important for a good fit,
Right.
but what would you advise somebody that is out there that has been in an accident, car accident, or fall or something traumatic, and then they or somebody notices some of these different changes?
Okay, well, the first thing I would want to rule out is anything physical. So there might have been a head injury. There might have been a head injury that is not normally seen. There's something called contre coup, which you probably know. So that means someone may have hit their forehead, but it really affects the parietal lobe in the back or the brain stem. You also want to see if they're on medication. Medication can affect people. Just as an aside, I interviewed someone a few weeks ago, not having to do with trauma, but she said, I'm really anxious more recently, blah, blah, blah. She's on thyroid medication. I don't know what made me ask her, but I said, how are you taking it? Oh, well, anytime I feel like it. I said, you have to take thyroid medication a half hour before you eat anything in the morning. She said, nobody told me that. And when I saw her a couple weeks later, I said, how are you? She said, I'm better. I think just changing when I take the medication made a difference. So that was great to hear. But you asked me some other things. Uh,
Changes in mood.
Changes in mood, yeah. So you want to make a thorough assessment and make sure it's not physical. You want to make sure there's nothing else going on. So maybe they had the accident, but they have a mood change because they were thinking of breaking up with their boyfriend or girlfriend anyway, and that might be impacting that mood. So you want to do a good assessment.
Okay. And we also, in our office, we do questionnaires to check for a concussion. And a lot of like the River Mead questionnaire, where we'll ask a series of questions. We also do another test that's on the computer that checks memory. It's called Impact Test, which is excellent. And a lot of sports teams and leagues use that to either get a baseline from where the person is, or to use for concussion or signs and symptoms of a concussion. So it's a good functional test to see how they're able to remember, react to certain things. So we do that as well, and we're aware that even if they don't hit their head, they could still have the head going back and forth.
Right.
Whiplash can actually still cause some of those changes.
Right.
And
Even if like I know like the River Mead has questions, it does ask like if they have depression, but they don't like to be honest with paper sometimes. Like even though I see them come in, even though I always ask them, how are you? How are you doing? They'll be like, yeah, I'm good, but like, are you sure? Or like it'll be either on the third or fourth visit, they're breaking down crying, like, what's going on? Like how can you, well, I mean, it's not a question, but like, I guess, how do you make your way to helping them seek help?
Oh, too many times people feel they're alone and there's something wrong with them if they go and seek help, and there isn't anything wrong with them. In the old days, we had family systems where people could go to elders and speak to them, and we don't really have that now. We might in other countries. Other countries are probably better at that. But you have to realize that human beings are societal animals, and that means we have to depend on each other. We have to rely on each other. We have to work with each other. And it's okay to go and ask for help if you need help. If I had a backache, I would come to you. If you have a psychic ache, someone should come to see me. And there's nothing that doesn't mean you're weak. It doesn't mean you're dysfunctional. It doesn't mean you have psychopathology necessarily. We just have to do that for insurance purposes, unfortunately. But yeah.
yeah. So one of the other reasons why I wanted to do this is to start a conversation, and that seeking help is not a sign of weakness.
No.
It's the smart thing to do, and to change the stigma that people have. If you go to a therapist, if you do that, if you reach out for help, I think unfortunately in our society, people look at that as a weakness, and we really need to work hard. And I thank you so much for coming on and explaining some of these things,
Thank you for inviting me.
so we can change it. So we can give information, and we can let people know what's out there and how they can get help on these invisible injuries that they have. It's easy for us to see a broken bone on X-ray, but when there's psychological effects and trauma, it's not easy to see that.
Right.
Even with normal brain MRIs and so forth, they could still have those injuries, those trauma. And I know Diana has seen some of our patients even that
Yeah, sometimes
have,
like either they cry or like sometimes they just they're coming there for treatment, but they like talk about their lifestyle, what they're doing, or like they're just either, oh, I can't work, like I'm constantly standing, but I have to stop my job, or I can't even go work at all, like I can't lose my job, I need this for to live, to pay my rent and everything. Those kind of break my heart, because it's like, oh, I'm here, but I can't really do much besides treat you, get you better. But as far as like them wanting to talk to somebody, I feel like they should seek that as much as they can.
And crying, I don't mean to interrupt you, is not a sign of weakness.
Yeah.
And there are some athletes I've seen that will cry. It's just a release, even after they might have won a fencing bout, for example. Okay? So yeah, it's important to be able to talk to someone though if you feel like you need it.
The good thing about it is like even though they're crying, I do hug them. I told them it's okay. I know it's gonna take time. It really is. It really depends how bad the accident is or how long it happened. I basically try to be a friend to them too, but also in a professional way.
Yeah,
You know.
it's a tough balance.
Yeah.
She is so supportive. The patients love her.
That's great.
And she helps not only with treatment, she helps train our staff. She is involved in making sure that the paperwork and other things like that, administrative functions with the patients, have been taken care of. So she's very supportive in all these different dynamics. And I know she's seen so much and has really helped and made a difference with our patients. We spoke a little bit before about your background and your bio, about EMDR. Now, let's just say some people are out there and like, what is EMDR? So what is it, and how do therapists use it?
All right, it's something that was developed by Dr. Francine Shapiro, who was a graduate student at the time, I think out in California. EMDR stands for eye movement desensitization reprocessing. And what she found out when she was out on a walk is she was walking and moving her eyes very quickly from one side to the other. And she was thinking about a problem she had. And once she was done, it must have been a very long walk, or she did it a few times, she realized that it felt different. She remembers the problem, but it's not quite connected to the emotion. So we now don't use eye movement as much, although there are still some therapists, psychologists, social workers that have a light bar. We use bilateral stimulation, which is either tapping like this alternately or tapping on top of the knees alternately. We're not exactly sure how that works. I guess in layman's terms, it helps the different brain parts talk to each other. So a lot of the fear is stored in the amygdala, correct me if I'm wrong. And what we want to do is get that more to the frontal lobe where we're more cognizant and it's a more of a cognitive memory as opposed so that we're not triggered. So that, oh yeah, there goes that train that I was scared because they had an accident, whatever, but they no longer feel the emotion, but they remember the incident. Do you know what I mean?
So you just mentioned trigger. What can you just explain that in lay terms so if people can understand? So if they had a car accident, let's say, what could be? So what does a trigger do, and what is it?
Oh, good question. A trigger could be anything that just sparks or makes you remember something. Okay, it could be a smell, a sight, a sound. It could be somebody. Maybe somebody has a particular look, and it reminds you of the person that hit you, or something of the sort, and you suddenly you could start shaking, crying, whatever.
Okay, so for example, could this be something that would be a trigger? You're in a restaurant having dinner, and then all of a sudden you hear a glass break on the floor. And in the car accident that you had 2 weeks ago, you had an impact and the glass broke. And could that be a trigger to make a person remember being in that accident and take a very defensive posture
Sure.
and have some changes that
Sure.
they've experienced?
They may have a really profound startle effect. They may, move back or try to duck under. We saw that a lot in veterans. They'd hear a loud pop and they'd duck under the table, and it was just reflexive,
Right.
I should say.
So if somebody has that, they should definitely see a therapist, see someone to be able to help themselves and so forth.
And EMDR, if you don't mind me saying, is a bit different than just talking about it. We used to think that talking about the incident over and over was helpful, and that's not true. That can actually re traumatize someone. So if I get someone in that's had something horrible happen, I try not to ask for the details. I might need some details because I don't want to re traumatize them. And I remember reading some research from years ago that really stunned me. Said that survivors of the Holocaust that were best adjusted were the ones that never spoke about it. Which
Wow.
I found, yeah, we're all
Yeah.
taught to talk about
Yeah.
it and get your anger out, and no, that's not the best thing to do.
Wow.
Yeah.
So that's actually great because some people out there might just keep talking about the incident with a friend or a sibling. And while they're doing this, they're just kind of rehashing or reliving it.
Right.
So, wow. And that can really drain on the person and maybe not help them to move forward. So that's the difference between just talking to a friend
Right.
and going to a professional for help.
But that's also, so if they want to talk about it, that's one thing. But if the friend or family members is prodding them, tell me about it. Tell me what happened. Don't press them.
Okay.
Don't press them because it's protective and defensive, and it keeps them going. They may say, I just can't deal with this now. I can't talk about it, or I'm going to break down crying, and I can't do that now. I need to keep going. I have XYZ to do, and I really need to keep it together. And that's okay. That's not a maladaptive response. It's adapting to what they need. Denial gets a really bad rap because they hear, denial, 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 and circles of alcohol and drug abuse. But denial is actually a good defense.
Okay.
It's just not good if it's overused.
It's like a coping mechanism for somebody to move forward. Now, yeah, so that's important because when you see a professional, like I was just mentioning, they're going to do an assessment and they're going to have treatments to help you move forward and to help a person recover from those injuries, those psychological effects of that trauma, which definitely need to be handled for somebody to move on. Because, hey, and we've seen this, and people that have not addressed these issues, these psychological scars, they might lose their job.
Yeah.
They might turn to drinking and drugs.
That's self-medicating.
They might go and get divorced, or they might have some other things happening because it's all reactive. They're not their true self,
Right.
and they have this thing weighing them down, so they're not able to be the person that they were, and they're totally kind of like taken over almost by or if it gets bad enough, I guess they could. But some people just they might not put one and one together. They had an accident, and then all of a sudden their mood totally shifts, and they get fired from a job, or they break up out of a relationship that was good, or they are not a great father or mother, brother, sister, what have you. So, those can be the consequences of not getting help.
Right. Right. And there was, I don't know if this relates, but I'm kind of tangential anyway. Dr. Sarno, and I never read his book. I don't know if he was a neurosurgeon or whatever, a spine specialist, wrote a book about people and back injuries. And he had noticed the x-rays of some people that had a really bad back never complained about back pain. And then there were people that had pretty good, normal-looking back that were complaining up the wazoo. And the difference was their emotional state.
Yeah.
And that their emotions really affected that,
Wow.
their pain level,
Wow.
which is interesting.
Mm-hmm. And have you had a patient that had a trauma that maybe it was in a car accident or something like that, and there were things that you kind of discovered of why she was afraid or he was afraid to do certain things and or drive,
Yeah.
and and then you help them. So tell us a little bit about
So I saw someone that had been in a pretty bad accident, had to be hospitalized for days, had multiple injuries, and was absolutely petrified to drive. And in her words, white knuckled every time just to even go to Publix. So her psychologist or social worker, I don't remember, sent her to me, and we did EMDR, which it's not magic. It doesn't happen overnight. It could take weeks. It could take months. It could take, I don't know, depending, years. But anyway, she came and we worked on it. She was able to drive fine. But she said, you know what? I still have one problem left. I said, what is it? She said, left turns. I get so nervous. I freeze. And by the way, freezing is a normal trauma reaction. I'm sorry, I forgot to tell you that. To freeze is normal. People watch too much TV and they're like, well, why didn't you do something? Why didn't you hit them? Why didn't you run? Because that's not a normal reaction. The normal reaction is to freeze. But anyway, you don't want to freeze when you're making a left turn.
Right, absolutely not.
Or the person behind you. Anyway, so I said, well, look, this is grounded in research. UPS has their drivers make mostly right turns. They design their routes that way because left turns are more dangerous. So instead of interpreting your body sensations, because you actually have trauma is stored in the body in different places for people, stomach, lungs, head. When you get that feeling, you need to reinterpret it. And it's a feeling that says, uh-oh, I really need to pay attention. You tell whoever's with you, you need to be quiet right now. And you need to focus on making that left turn. It's okay. You're not in danger. It's just saying, hey, use a little more caution crossing this street.
Right,
Okay?
right. Okay. The other thing that we've seen sometimes in our office, right, Diana, is patients that have difficulty sleeping and they come
Yes,
into the
they
office,
do.
right? And they're,
Yes. I don't like it's. I don't know if it's always pain because again, they go home. I just work, but they constantly say I can't sleep. Sometimes it's either due to pain or just because they can't sleep. Like, what could that be a trigger to?
What could it be? Well, it's probably caused by a lot of anxiety. They're just worrying. They're ruminating a lot.
Okay.
So I don't just do EMDR right out of the gate. We could do a relaxation exercise. We might do some hypnosis. We could do some talking about it, some reframing, which is mostly what cognitive behavioral therapy is. We could take a sleep diary and find out a lot of times people are like, I can't sleep at night. Well, what time are you going to sleep? Well, 9 o'clock. Well, maybe it's too early.
Yeah.
right.
And people are a little startled by that. And they delay their sleep time, and now they have a great night's sleep. But anyway, it's usually worry and anxiety
Okay.
takes over.
Yeah, and we see that, and I think there's some links too that I've heard of pain and depression, even so chronic pain.
Of
So
course.
people that have that,
Well, yeah. I mean, if you're in pain, it colors your whole world.
yeah,
And it could be good or bad. I had a good experience with pain once, actually. I don't like public speaking.
Same.
Fooled me. Anyway, I had to speak at this school that had a record number of stairs. And I had had a bicycle accident a few days before, and I was aching all over. And of course, I have no sense of direction, and I got lost. I went up and down, I don't know how many flights of stairs. By the time I get to the room I'm supposed to be at, I said to the lady, I said, I'm in so much pain. I don't think I could do this. And she said, you have to. You're the main speaker. I said, what?
oh my gosh,
So I thought, well, fine. I will kill two birds with one stone here. I will give the talk, so I fulfilled my requirement, and I will screw up so badly they will never ask me back. Win-win.
that's so funny. Wow,
And it turned out to be the best. I was really relaxed because I could care less.
right? Because your mind was on something else.
Well, yeah, I was like, oh, okay, let's do it. Let's go. And It was fine.
That's great.
Yeah.
That's great. So, a couple of different things. I wanted to say, if someone's out there, what and they're listening to this, not that and this is not a substitute for not going to a doctor or a therapist to get treatment. But if they wanted some coping mechanisms that they can do, if they're feeling this anxiety, if they're having, they think, changes with their mood or sleep issues, or a myriad of different things, and they did have an accident, they did have a trauma, or maybe their spouse did, or maybe their brother did, or their child, what are some things that are easy for people to do that might help with this the psychological effects of trauma?
Well, if you think of anxiety, anxiety is energy, and you need to discharge this energy. Okay? So go out for a walk, go out for a run, go out for a bicycle ride, do something physical, be active, even if it's just cleaning the house. Maybe I should do that instead of walking. But anyway, get active and do things. And by the way, there's a program at Murakami. I think it's called Stroll in the Park. And I think last year it was a pilot. And what it is they have a program for people that have experienced different traumas. You don't have to come out and talk about it. And they have a required, 2-session thing there. And then you could go whenever, and they give you a pass for a year.
Wow,
Free.
that's
Yeah.
great.
It's really great. And every person that I've sent there, you need a letter from your doctor, and I'm never specific about what happened with them. I give the letter to the patient, so I don't need a release. Every single one has said how beneficial it was for them, how one person, that was the only place they could find peace. Another one was that was the only place she could journal about her loved one that had passed. So being out in nature can have a profound effect. And also something else people can do that research has shown really helps is journaling.
Yeah, I do that a lot.
do that?
Yes.
I don't like journaling because I have to write, but I force myself to do it. If I'm going through something, if I'm going to give this advice, I better take it myself. So I do it. You just write the date. You don't write it for anyone else. They don't have to be complete sentences, spelling nothing. Thoughts, feelings, what went on. And after some time, you might find a pattern. Like, oh, wow, when it's raining out, I feel better.
Yeah.
Which is contrary to what you would think. So you might find patterns. You might say, was I really feeling that way a few days ago? You might, what was that about? And you could examine it yourself. So that is a really good thing that research has proven. People that journal that are in therapy get better faster.
That's great. That's great. So we have physical exercise, wellness,
yeah.
journaling. What about and exercise and so forth goes with that. Anything else? That maybe habits, staying away from coffee after a certain point, or anything else you've heard?
Well, coffee gets demonized a lot.
I love
Probably-
coffee.
I do too.
I love coffee.
I went to preschool with coffee. So. Anyway, probably don't drink alcohol because that could have some negative effects. It could have some rebound effects. I don't know that much about the research on marijuana, but probably stay away from substances like that because we really don't know what the effect is. And nowadays, especially for young people, young men in particular, the marijuana is so strong that it could cause a psychotic break.
Wow.
And once you have a psychotic break, you're more vulnerable for the rest of your life.
Oh my gosh.
Yeah. So the earlier you have that in your life, the worse it is for the kid.
What about meditation or something like that?
Meditation is very good. Also mindfulness, which is different than meditation and different than relaxation.
Okay.
So, be mindful of what you're doing and be in the here and now. So many people are like, oh my gosh, I'll never get better. I'm not going to be able to do X, Y, Z in a year. Well, it's not a year from now. Just deal with today. What do you have to do to get through today? That's it. And that's where denial comes in. We don't know about tomorrow. So let's just draw a little circle here, a little box. We're safe in here. It's just today. What do I have to do?
Great.
So you
great.
limit your obligations and so forth.
Yeah. So, and I do also in my office acupuncture.
Oh, that's nice.
And sometimes after I do it, patients are just so relaxed.
Or like they don't
just,
know what acupuncture is until like we tell them because they, go through headaches and then I'm like, oh, well, Dr. Sutton does acupuncture. He goes, oh, really? He goes, yeah. But even though they say, oh, really, they don't know what it is until it actually happens. And then once they experience, like, wow, I feel so much better. I'm very relaxed.
That's really interesting. Yeah, we have something called tapping, where we tap different areas, and the top areas to tap for are the cheeks and the collarbone. The collarbone does nothing for me. I don't know if that's an acupuncture.
well, there are some around there. Yeah.
But if you look at the Home Alone kid, he's like this.
Yeah.
All right?
I know.
And if I watch a scary movie, it's automatic. I go like this,
Yes.
automatically. So, those are known as chakras, or there's another word for them. I don't know what it is.
There are acupuncture points,
Meridians?
meridians, correct.
There you go.
Yeah, so people report or they experience after. Now, it's not everybody, but
Right.
many times they'll experience that. Sometimes patients, after their treatment, they have so much tension in their body. So after they see us, they'll be like a different person walking out.
Like they could probably have like a bad day or like, okay, and the next thing you know, oh, hi, bye. I'll see you next time. They would just be so happy. It's just like their mood literally changed from the moment they walked in to the moment they walk out.
Oh, I believe it. I believe it.
So they experience that too. What about like just taking a vacation, like a little getaway or something like that after you've had something stressful?
That's a great idea. Yeah, because you're in a different environment. You can clear your mind. You could think of something else, and it gives you some creative space to think about things
Right.
differently.
And we're not going to talk about this in detail. Okay. So don't worry.
Okay.
Okay. Because I know it's getting late. But pets, sometimes for me, I have 2 dogs. I love them. And I could come in and have some stress and I sit with my dogs and I pet them and they feel great. And there's emotional support dogs. There's people that see therapists and they can learn about how to have emotional support dog or get a dog that's trained for that. We're going to do in the future episode on emotional support pets and really dive into that and how that can help people that are injured.
Well, touch is very important. And you see that with premature babies. They have, I don't know if they do it here in the U.S., but I remember reading about it many years ago. Carrying a baby around, a preemie around, they gain weight faster. They're all around better. So, yeah,
Nice.
it's a good thing.
Interesting.
Yeah, and so also we had spoke earlier, and some of the websites that people can go to find a therapist, somebody that has a background in either they can go to EMDR, International Association,
Oh,
and
yes.
they can try to find a therapist that has that type of training. www.evergreencertifications.com and look for somebody, or emdia.org. Find an EMDR therapist. We'll put this in the show notes so people can check that for resources if they want to find somebody and learn more about these type of therapy. Find a therapist that has a little bit more background with treating people that are in traumas.
But you should also call those organizations, because I'm certified by Evergreen, and I went on some list site and I didn't find my name. I called, I said, what, are all these people better trained? And I told her, she goes, no, you're better trained than them. I said, well,
Where am I at?
where am I listed? Where does one look? So it's good to call as well.
Great. Okay. And the other thing I wanted to mention, because Dr. Wells, we see you as a superhero and helping patients face challenges most people never see. To celebrate that, we have a little gift for you, superhero tumblers.
Okay.
So I have a gift for you because you're like a superhero to so many people, and we appreciate you. So
Aw.
this is a gift, and we give to you. So which type of tumbler do you like the best?
I know you gave me the list before. Superman's my favorite. Maybe I'm a traditionalist, but I used to watch him after school.
Awesome, awesome.
Thank you.
Great,
That's
great.
sweet.
So yeah, and we really appreciate you coming on the show. And in the future, we're going to be bringing more information about how people can be educated about injuries, about how they can get help, and then also be inspired. So in the future, we're going to have people come on and find what has helped motivate them, inspire them to move forward. So thank you. I want to thank both of you for coming on the show today.
Thank
For
you
the
for having us.
invitation.
And having such a great time and informing everybody. And I wanted to thank you guys for tuning in and watching us either on our YouTube channel or through our podcast. And like what we say every time, like, follow, subscribe. We'll see you on the other side. Let's get strong together.
That's great.